This is a CJSON podcast, and I'm Dr. Gjerde from the University of Bergen. On behalf of my co-authors, it is my pleasure to introduce to you our study, Intrauterine Growth Restriction and Risk of Diverse Forms of Kidney Disease during the first 50 years of life. Previous studies have shown that individuals with low birth weight or small for gestational age have high risk of kidney failure. There is a need for better data on the association between different markers of intrauterine growth restriction and risk of clinical kidney disease at an earlier stage than severe kidney failure. The Medical Birth Registry of Norway has registered extensive medical data on all births in Norway since 1967. In total, 2.7 million individuals born in Norway between 1967 and 2015 were included in our study. The Norwegian Patient Registry has registered diagnostic codes for all admissions and outpatient visits to Norwegian hospitals since 2008. Data from these registries were linked, and risk of chronic kidney disease and other groups of kidney disease were analyzed. After a mean follow-up of 26 years, 4,495 individuals had been diagnosed with chronic kidney disease and 12,818 individuals with other groups of kidney disease. Low birth weight, defined as birth weight less than the 10th percentile. Small for gestational age, defined as birth weight less than the 10th percentile for gestational age, and preterm birth, defined as birth earlier than 37 weeks, were analyzed as risk markers. The main outcome was defined as having been diagnosed with chronic kidney disease on at least one occasion, admissions or outpatient visits. Both main diagnoses and secondary diagnoses were included. The secondary outcomes were having been diagnosed with different groups of kidney disease: acute kidney disease, glomerular disease, cystic kidney disease, or kidney or urinary tract malformations. Stage 3, 4, or 5 kidney disease was also analyzed as secondary outcome. The present study of the Norwegian population showed that intrauterine growth restriction was associated with a 60 to 70% increased risk of being diagnosed with chronic kidney disease during the first 50 years of life. There was also significantly higher risks for other diagnostic group of kidney disease, but not as strongly as for chronic kidney disease. We have found a 40% higher risk for acute kidney disease and a 20% higher risk for glomerular disease, cystic kidney disease, and kidney or urinary tract malformations. The associations were similar for chronic kidney disease stage 3, 4, and 5, and similar for men and women. Given the high population prevalence of chronic kidney disease and the high comorbidity and mortality, our results may have public health importance. Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.